Okay, so Bismillahirrahmanirrahim. We are here for the tiny talk over this one specific topic. So as maybe I will try to make it very short and very simply describe, inshallah. Okay. Okay. First, what is Valsalva maneuver? Usually we are using it where we are using it in SVT, right? SVT, we are using it, right? First, we are using for the, whenever a patient coming with SVT, supraventricular tachycardia, first thing to start that is SVT, because this is non-invasive, okay? So you will start that. If this fail, then we are going up to the adenosine maybe, right? So another place also you can use this Valsalva maneuver where this is, if sometimes middle ear pressure is high or low, you can normalize that middle ear pressure. Okay, dear? So that time also you can use this Valsalva maneuver. Then what is this maneuver? When a patient is coming with you, like he's telling, I'm feeling restless, and you see the yes pulse rate is very high in the ECG, it's coming supraventricular tachycardia. Immediately you will start Valsalva maneuver. Okay, so what's it that we are usually telling the patient? So if yes, dear, anything? Would you please mute yourself? Otherwise, there is background noise. Okay, thank you. Okay, so what we are telling, if this is the patient, okay, this is the patient. So if this is the patient, so what we are telling, we are giving them one syringe. We are giving them one syringe and tell him to blow. This is maybe the syringe, this part, sorry. We tell him to blow it like that, okay? So, but it is so much hard, right? So he cannot pull it outward. So what happened, actually, we are stopping his mouth. We are sealing his mouth. With this procedure, we are sealing his mouth against the forceful expiration, against the glottis. Yeah, exactly, against the glottis. We are doing this expiration. So we are telling them to blow it out, blow expiration forcefully, so that the air is not going outside. So what happened? The glottis is closed. So actually the mechanism is we are doing this forceful expiration against this closed glottis. This is the main mechanism. Okay, so within these few seconds, so many things happened. Okay, there are 4 stages. What happened? Now this is our thing to understand, that what is actually happening when there is this procedure happened. Okay, so there are 4 stages. Okay, 1, 2, 3, and 4. Okay, so this 1 and 2 stage, this stage, actually, this is the stage, this yellow color, this one and 2 usually happen when your forceful expiration is doing that time. Okay, after you stop, then the number 3 and 4 happening. So what happened during this 1 and 2 phase? What happened? So first, when we are doing this forceful expiration, we are exhaling, right? It's not inhalation, it is forceful exhalation, right? So what happened in your body? You are actually, all the intercostal muscles, all the muscles against the rib cage, is all the muscles are going inward. It is going inward. Okay, and also the diaphragm relax and it going up. The diaphragm relax and it going up. So what happened? What happened? That all the pressure inside this thoracic cavity, it is what increased, because the air cannot be go out. We have sealed this. We have sealed this. So the air cannot go out. So the pressure inside this thoracic cavity, it is going so much high. So what happened inside the heart? Inside the heart, if it is like your heart, this is also, let me draw the heart. So what happened? Inside the heart, if it is the heart, If it is the left side, it's the right side. This is maybe the aorta. I'm simplifying, okay? And this is maybe the inferior vena cava. This is maybe the superior vena cava. Okay, dear? Okay. So what happened? We have already increased the pressure over the intrathoracic cavity. So pressure over the heart and all the vessels increased, right? From outside. So if you now measure the pressure inside this aorta, this is the mean aortic pressure, what will happen? This blue line, which I have drawn here, it is increased. It is increased. This is the first part. This is the number one phase. What happened? The aortic pressure is raised because we are giving pressure. And whenever the aortic pressure is high, what happened inside that aorta? There are baroreceptors. So what happened? These baroreceptors are taking the signals and sending it. Please stop the videos because it's being recorded. So for your own safety, this one, okay, dear? So better, please stop if any videos are there. Okay, so what happened? The aortic pressure is high and the baroreceptor will give you the signal that this is the parasympathetic nervous system, right? They will stimulate the parasympathetic nervous system through the vagal, 10th cranial nerve, right? So they will tell the pressure is so high, please come down heart. They want to come down the heart, the PNS system, right? So what happened? They will decrease the heart rate. So this one, aortic pressure is going up and heart rate is going down. This is your phase one. This is your phase one. Okay, dear? Please mute yourself. Very difficult to tell every time. Okay. So now this is the first phase, okay? That aortic pressure is high and heart rate is going down. Now come what happened in the second phase. Second phase, what happened? The heart is always in a systolic and diastolic mode, right? Once systolic, then diastolic, again systolic, then diastolic, right? So in the phase two, what happened? There is like relaxation in the diastolic phase, okay? So whenever there is relaxation, obviously they will have the venous return, right? There will be venous return, right? From the upper limb and lower limb, from upper part of the body, lower part of the body. But as the pressure is from outside in over every vessels, veins, aorta, everywhere we have given extra pressure because still our Valsalva maneuver is going on. Still we are like stopped our mouth, okay? So what happened? This venous return is not that much. So there will be reduced venous return, right? So there will be reduced venous return. So there will be blood less in the blood, in the heart. So if there is less blood will go with the cardiac output through the aorta, right? So what will happen? The aortic pressure will be go down. This is my phase two in red. This is my phase two in red. So what happened? It is going down. When it is going down, the pressure falls. Now sympathetic nervous system, this is stimulated. So what happened? Heart rate will go up. So here first PNS, parasympathetic nervous system. Now here sympathetic nervous system. Okay, dear? Now think about this. So now what happened? This pressure is going down and heart rate is going up. Now think, what about the other vessels of the body, like our upper limbs, lower limbs vessels? So sympathetic nervous system, what they will do? They will try to squeeze the vessels, the peripheral blood vessels. They're telling, please, there is low blood in the heart. So they will constrict the blood vessels from upper limb, lower limb. So the venous return, they will try to put some of the blood vessel with squeezing all the peripheral blood vessels. So there will be a little bit of more blood, not fully, maybe a little bit more than the before. Okay, so what happened? Blood now a little bit more comes to the heart. So cardiac output against it will be high a little bit. So what happened? Here there will be a transient rise up of the aortic pressure. Not that much, because we couldn't fill up even with squeezing of all the blood vessels. But there will be a little bit of high aortic pressure. So again, the peripheral nervous system as again high, it will come down. The peripheral nervous system will stimulate the vagal nerves, heart rate will come down. This is up to our vagal maneuver. Okay, so this is usually within 15 seconds, it's gone. 12 to 15 seconds, the Valsalva maneuver. After that, we are taking away the syringe from the patient. Now what happened? Now it's being relaxed. Now it is being relaxed. So see, within this Valsalva maneuver, what happened? First is working peripheral nervous system, then parasympathetic nervous system, then sympathetic nervous system, again parasympathetic nervous system. Okay, now come to, aside from this yellow line, now we are out of this maneuver. Now he's relaxing. The patient is relaxing. I have opened the glottis, so air is going out. All pressure inside the thoracic cavity. Now it's okay, alhamdulillah, it's released. Now it's released. All the pressure from outside, now it will be released. Okay, so now it's being relaxed. So what happened? So pressure in the aorta, it will be, so if there is no pressure from outside, what will happen? Pressure will go down, like in the phase 3. Sorry, it will be, yeah, pressure going down, aortic pressure, because I have suddenly relaxed that one. So if pressure relax, again heart rate going up. Mean aortic pressure release, that means heart rate will go up. Then what happened? At the last phase, all the blood that in the limbs, they were waiting actually. They were in a traffic jam. They couldn't push that much they wanted. So all they are telling, okay, the pressure road is now open. Let's fill up the heart. So they all gushing up to fill the heart more. So more cardiac output. So there will be more cardiac output. Aortic pressure will be more high. So this is number 4 stage. Okay. So after that, ultimately what happened? It come to the ultimately normal, because there is like parasympathetic, sympathetic, parasympathetic, sympathetic. So ultimately the heart is we are confusing the heart to get the normal heart rate, because there is supraventricular tachycardia. Tachy is there. I want it to come down. Okay. So whenever this confused method is going on, ultimately the heart is going to the normal state. Okay, dear. So these are the 4 stage of your Valsalva maneuver. That's how it's working. Okay, dear. So just remember the graph. If you remember the graph, it is so easy. And how you can remember very easily, even if you forget every pathophysiology, what you will remember? Just a trick. Ouch, I'm sorry. Let me just clean it up a little bit. Okay, so you will remember, let me choose some extraordinary, maybe the Barbie color. Now Barbie craze is going on. Let's go with the Barbie color. Okay, so how we will remember easily. So whatever happened, it's like, you see, so if it is go up, heart rate is going down. If it is going down, heart rate is going up. So if somebody first they want to go opposite, then they want to come to meet. If like that, if you remember, you can remember the graph. Actually, if they are asking you, they will ask you that what happened in the phase 1 or what happened in the phase 2, and where we are using this, where you are using this. So phase 1, we are increasing the thoracic cavity pressure. Okay. Phase 2, there is reduced venous return, right? So like that, if you can remember the graph easily, that first it is going here, I mean away from each other. Then in the phase 2, they're coming together. Okay. So if you can remember like that, it will be very easy, inshallah. Okay. So this is all about our Valsalva maneuver. Okay. And this is important because nowadays the pathophysiology, this is the part of a basic science actually. though this is cardiology part, but all the basic science, this type of questions, if they are asking, this is actually they're counting as clinical science question. Okay, so if you don't know, if you know just one, maybe if you're giving just 10 minutes to this graph, inshallah, maybe one question you will get it right. Okay, anyway, thank you everyone. Allah Hafiz.